Okay, hi. Do you suffer from Parkinson's disease, or do you or a loved one suffer with Parkinson's disease or a movement disorder, a tremor disorder, a weakness in the body? My name is Dr. Herman, and I am here with Mr. Kroc, who comes to me from North Carolina. My clinic is here in South Florida right now. We're here January 10th of 2019. And Mr. Kroc came in today for his second visit with me, his second exam and second consultation. And so we're just going to ask some questions here. And this will just take a few minutes with him to describe some improvements that he's experiencing since he's been with me in this work that I'm offering him and other people. And then you'll see the second part of this video. We're going to transition into the findings, the unique findings of what I discover, of what I've discovered in his body. Hidden disease-causing infections and hidden disease-causing toxins are in areas in the brain that produce dopamine and in areas of the brain that help to regulate motor control or motor movements in the body. So that's really important. That's what we've got to understand. So Mr. Kroc, you noticed your first symptom was a tremor, and that was about how long ago?
4 years ago.
Okay. Did you have any kind of doctors who evaluated the tremor back 4 years ago?
Yeah, I went to a neurologist in Santa Barbara when I was living in California, and he looked at it at one time, and then 3 months later looked at it, and he said he thought they were benign tremors.
Benign tremors. Was there a medication given?
No medication.
No. And it wasn't called Parkinson's at the time, just benign tremor.
Yep.
Okay, and so you let's fast forward a little bit here. Your Parkinson's diagnosis that you have now, that was given to you about how long ago?
Last June.
June of 2018.
Yes.
Okay, so you're talking about 3 years after you first had the tremor when first told benign?
Yes.
A little more than 3 years, or about 3 years?
About 3 years.
Okay, so and the reason, now before you were told Parkinson's, let's say about 2 years after you had the tremor start, you told me you went to another doctor.
That's when I came out here to North Carolina.
We don't have to mention the doctor's names, by the way, so let's leave that out because nobody. Okay, we don't need to say anything about them. But
I went to a neurologist here in North Carolina, and he started the process of trying to figure out what was going on. I had a brain scan, MRI.
A brain scan and MRI. Did those say anything? Did they say anything from the brain scan or MRI?
They thought that there was extra pressure. The orifice or the space in the brain was larger than normal, so there's more fluid than brain. Mm-hmm. I don't know if that makes sense.
Yeah.
But anyway, that's when they started doing the different tests to see if it was high pressure.
Hydrocephalus, too much water, too much fluid in the brain, too much pressure. That was the word you were looking for.
That was the one.
Okay. So what kind of test did they do?
Well, they tried to do a spinal tap and poked me about 4 times and said that didn't work, so they put me in the hospital for 3 days and did the spinal tap, drained my spinal fluid for 3 days, and then would get up and do my dexterity and all my different Parkinson's tests, walking, and they found that it did no effect.
No effect with that. And after that spinal tap and drainage was done, did those doctors offer you any other insight, any other kinds of tests?
No.
Any other kinds of treatment, physical therapies, anything? Was there anything offered by them?
They sent me to another doctor.
Okay. And this other kind of doctor was a neurologist as well?
Neurologist.
Okay.
He was a movement specialist.
A movement specialist?
Yeah.
Okay.
And so he looked at me, looked at the paperwork, said, well, they just wasted 3 days in the hospital.
And
you got Parkinson's, I'm going to give you some meds, and you're going to come back in 6 weeks, and we're going to see how the meds work.
Okay, and the medication that he gave you, and this is how long ago?
This was all in
June?
June.
Okay, June of 18.
Yes.
And so you went for about a year, let's say a year and a half, after the first, when that doctor you saw 2 years ago, and then he then sent you for the spinal tap and that whole evaluation, MRIs and brain scan, and you were still living for about a year and a half before you met the second doctor, the
Yes.
second neurologist, who said, it's Parkinson's, waste of time, Parkinson's, here's the carbidopa levodopa, right?
Yep.
And so with the carbidopa levodopa, you did tell me that you noticed some decrease in symptoms, yet, so you came to me between June of 18 and October of 18, because your first visit with me was October 9th, I think, of 2018.
Mm-hmm.
And with your, why did you, let me ask you this, why was it that you were still looking online, on the internet, watching videos, that you came across my information, what were you looking for when you were already seeing some improvement with the Parkinson's carbidopa levodopa medication?
Well, what I'd heard and what I'd seen, medication is just going to medicate the symptoms. It's not going to fix the problem. Mm-hmm. And the side effects from the medication, I felt, would be worse than just working at trying to get rid of the disease versus try to just medicate it to cover it up.
Okay, understood. And so you read something or you heard something from me online and decided to come here. Obviously, you came. So right now we're just going to talk about his symptom changes that he's experienced for the positive, for the better. And the reason why we're doing this is because there was some improvement in one round with me. And I'm just going to tell you all who are watching this, the speed of recovery varies from one person to another. Each individual person has a different set of hidden infections and hidden toxins that are in various tissues of the brain and the body that can cause the brain to malfunction, not be able to control the body the way it's supposed to, the way that you want it to, the way that it should. So each person heals at a different speed. We've got to understand that. But in 1 month, I should not say that, excuse me, I take that back. In one protocol between seeing you from October 9th, you did a protocol that was about close to 3 months long, and you came back here January of 2000, today is January 10th of 2019. And so one of the symptoms you told me is that your dexterity is better.
Yes, it's being able to put my clothes on and button my shirts and even take them off has been a big difference. And when just washing my body in the shower, my right hand would do the normal things, but my left hand wouldn't.
And that was even with the Parkinson's med.
That's even with the Parkinson's med.
Even with the Parkinson's med that you were taking 3 to 4 times a day, once every 6 hours, right?
Yes.
So you still had, even with that medication, even though you were functioning a bit better with the Parkinson's med, you still had the left hand not being able to do what the right hand could do in the shower.
It's gotten better over the last, well, since I've been on your protocol.
Yeah. Well, I'm saying before this protocol, with the medicine only, my point was with the medicine only, before you came to me, between June and October, the left arm still wouldn't do what the right arm would do in the shower.
Correct.
Yeah. And so right now, so can you describe, like you were, we're just going to say, washing your armpits in the shower.
Yeah.
The right hand could, but the left hand couldn't.
Yeah, it wouldn't go up and down.
Okay, and now it does.
And I could just barely go sideways.
And he's doing it right now.
Couldn't go up and down.
Now you're doing it right there.
Yeah.
Right. You also clothing yourself, so buttoning and zipping and putting on socks and shoes.
Yes.
You can do all that now.
I can do that again.
Yeah. And you also, like, even putting on deodorant.
Yes,
Yeah.
that was a big one. What's wrong with this hand?
And so also you told me, what was the other thing you said? When you're making a food, you said peeling what?
Potatoes. My granddaughters, they said, "Come on, Grandpa, what's going on? Let's get the potatoes peeled. We got to get dinner on the table."
And now?
Now I can peel potatoes again.
Excellent. You also said that your speech is better. What was different about your speech between before and right now? Before we started together and now since you completed the first protocol?
I had to talk real slow to make sure that I didn't slur my speech, and mainly when I was on the phone talking to somebody. And if I was talking like I am right now, I'd had to go real slow so that I didn't slur my speech. I didn't want people to know that what I was dealing with.
And now since you've, at least maybe during or since after you completed this first protocol with me, your speech is not slurring? Or
it does a little bit, but it's got to be down about 60% from what it was.
60% improvement.
Yeah.
Awesome. You also said that your walking is better. You said that, I think there are two things about, I'll mention both symptoms. You said shuffling and walking straighter, standing up straighter. So what about the shuffling, do you think, or how much improvement, percentage-wise, how much less or how much improvement in the shuffling experience are you experiencing now compared to before we started together?
Well, I think it's about 50, 60% better than what it was.
And the walking straighter, you said, more because you were walking with more of a slouched posture that you feel.
Yes, sometimes walking, I have to think about it, but it's not. Before I wasn't even thinking about it, but now I think about it, and I can stand up straight when I go out and walk the dogs. 6 o'clock in the morning, it's kind of hard to be awake, but to stand up straight, and it's just getting better.
Excellent. Memory was a problem before we started together.
Yeah, it's the cognition, being able to carry on a conversation, explaining somebody what I was trying to do, what our program was.
So that's better. Memory, cognition seems better to you?
Yep.
You said about you used to be easily distracted. If you're working on a task that you're familiar with, before this care you were easily distracted. And does that feel the same or better now?
That's gotten better.
You have better focus?
Clearer.
Okay. So right now we're not saying in this protocol and this video, we're not saying that there's 100% improvement in one round. And we're not expecting that to be 100% improvement in one round, reversal of these symptoms. What we are saying, or what you are saying, I should say, you're stating this to me, is that you have overall with several of your several symptoms, or several, let's say 7 out of 10, for example, you're having, I'm not giving an exact number there, but let's say 7 out of 10, you're having improvement in those.
Yes,
in those
definitely.
various things. And in a good number of those, there's between 50 and 60% improvement.
Yep.
In those different symptoms, less than it was before.
Yes.
Yeah, excellent. And
Yep.
you're still taking the medication?
It's okay. Still taking the.
Carbidopa, levodopa.
Yes.
Yeah, and so eventually, as you keep improving, when we keep peeling away the different hidden infections and toxins that have caused the disease, it's only going to improve even more to where I believe that you will be able to decrease that medication. And I've seen other people do that as well with this work.
That's what I'm looking forward to.
Excellent. All right, thank you for taking the time. I appreciate it. Is there anything that you want to say to anybody out there? Is there anything at all about this?
I'm just glad that I kept a curious mind and decided to go online, and I just by chance, just by searching Parkinson's, I ran into your videos, and I was very impressed with the results that you were getting and the interviews with the different patients.
All right. Thank you.
Thank you.
Appreciate you.
Appreciate your hard work.
And so you'll stay tuned to watch the other part of this video, and also the phone number is for you to call and schedule your appointment here, 954-370-3100. That's 954-370-3100. I'll even put the email address of my clinic assistant who can help you schedule your appointment. I will tell you, even before I get into the next video, that the medical insurance, your healthcare insurance coverage, does not cover this type of work that I'm offering. So this is more an investment in yourself. Okay, my assistant can help you with any details about arranging appointments for yourself and or a loved one. I look forward to helping you, and definitely listen to the next part of this video, which I'll be describing the different kinds of hidden and disease-causing infections and toxins that caused him to break down to the point where he wasn't getting any better. And as well, even though there was some improvement with the medications, let's not take away from that. Are you or a loved one suffering from Parkinson's disease? Are you suffering from movement disorders, tremor, shuffling gait, slowness getting started walking, slowness or difficulty getting up out of a chair, getting up out of bed, putting on your clothes, trying to put on your clothes? Are you experiencing difficulty with the dexterity of your hands to be able to just button a shirt or button your pants and zip up your pants or put socks on or put your shoes on or wipe yourself or brush your teeth or feed yourself? Are you having a difficulty with your ability to, even in some cases with Parkinson's, there's a difficulty with being able to remember things. Cognition can go down, memory can go down, energy can go down, fatigue can be in the body. My name is Dr. Herman, and I run a very unique practice here down in my clinic in South Florida. right now. And what you have just seen with this video of this gentleman, Mr. Kroc, who comes to my clinic, he is reporting, as you saw in that video, that he's having great improvements after he followed his first protocol with me. And I'll describe the findings in this part of this video right now of what I found in his first protocol that was not discovered and not understood with any of the doctors that he's been to so far, any of the neurologists or any of the hospital physicians who had evaluated him in the past. And one more time, just to repeat what he says with his improvements in this first protocol, that his slurred speech has improved 50 to 60% is what he reported to me. His dexterity is better now, even better than when he was using the dopamine medications alone. He can clothe himself, he can wash his armpits, he can put his deodorant on, his writing is better. When he was writing, he's a right-handed person, when he was writing, as the sentence got longer, the letters would get smaller and smaller. So he said that now, when he writes, the letters are all staying the same size throughout the whole sentence, which is great for him. And it could be great for anybody else who's experiencing that same kind of symptom. He can now peel potatoes and cook with his granddaughter, as he said. His walking is better, he reported. He's not shuffling as much, 65% less shuffling. He feels as though his forward posture, his rounding forward shoulders and head forward posture is not as bad as it used to be. He's standing up straighter when he walks. His memory is better. His cognition is better. He was actually able to, in this round here, he was telling a couple of jokes with my assistant, which was very nice to see. And but he still has tremor in the jaw. He still has, after his first round, he still has some tremor in the hand. He still is not perfect, but he's improving with his functions, improving with his brain function, improving with his body functions, improving with his memory, improving with his cognition, improving being able to stay focused on a certain topic that he's discussing with a person, which he was losing that for quite some time before he started with me, and when he was going to other so-called really important, really knowledgeable physicians in the world of Parkinson's and brain disorders like dementia and so on. He was going to these different doctors who weren't able to help him get the job done. He does have some improvement, as he did report with his dopamine medication, but he's having even greater improvement from this unique work that we're doing together. And I'll just tell you that he did report to me, which we didn't talk about in that last part of the video, that his cognitive function, his memory, he felt declining for the past 10 to 15 years, and he's seeing a great improvement in that function now. We started together, his first examination was October 9th of 2018. His second examination was January 10th of 2019. The video that you just saw, the interview I did with him, the testimonial I did with him, which is not 100% recovery. That's not what we're reporting in that video. What I'm reporting in this video, I'm here to help you understand that there's a totally different point of view than what you've heard from the mass media, from the news, and from the doctors in the different hospitals or universities that you've been to, and the top neurologists that you've been to, or videos that you've watched online by the top quote-unquote so-called doctors in their field about these movement disorders, about chemistry disorders like dopamine deficiency in the brain is what they're telling you. This is going to give you a totally different appreciation of what can totally be causing your memory, your cognitive impairment, and your movement disorder. I also want to say, before I get into this person's exam findings from these two different visits that we've done, the first visit and now the second visit, which he hasn't completed at the time of recording both of these videos, the interview with him and now me reporting this, is that the speed of recovery varies from one person to another. Many different people have many different complications, hidden infections and toxins, disease-causing infections and toxins that are hidden in different parts of the brain and the body, which will make the body malfunction. I also invite you to watch some of the other videos that I put up online. If this is the first Parkinson's video that you're seeing from me, I invite you to watch the other videos I put up. There are videos of other patients who are experiencing improvement with my work. There are videos where I'm describing different parts of the brain, as I will be getting into in this video. I just think it's very important for you you may agree with us or you may not agree with us. Some people just want to get better. Some people really want to understand their brain a bit better, because most people who are suffering from Parkinson's are trusting in their physician to know what's going on with their brain. Yet these people who are going to, like possibly you and or a family member or friend of yours that you're watching this video for, maybe you never went to school for anatomy and physiology and central nervous system studies. Maybe you never went to school for brain-based studies. Maybe you never went to school for movement disorders. Maybe you never went to school for neurochemistry. Maybe you never went to school for immunology. Maybe you never went to school for dentistry. Maybe you never went to school for biochemistry. Maybe you never went to school for endocrinology or blood chemistry analysis or gastrointestinal disorders. Maybe you've never gone to school, and I'm not knocking you. Everybody has their own direction in life, whether you're a house wife, whether you're a mother of maybe 1, 2, 3, 4, 5 kids, maybe you run a big business and you're a multi-millionaire, a billionaire traveling around the world and you're running major businesses, or maybe you have a small business that's running a dry cleaning location, or maybe you're a house cleaner, or maybe you run a restaurant. Whatever the case is, maybe you're an actor or an actress, you haven't spent more than a decade of your life studying the central nervous system and all the other parts that are connected, the cardiovascular system, the immune system, the lymphatic system, the dental work. Maybe you haven't, and toxicity and infections. Maybe you haven't studied all of these different topics. That's what I have done for the past 11 plus years of my life. But maybe you haven't spent the time with those. So when you go to your doctor at whichever major university or hospital and you're looking for answers from this quote-unquote top neurologist in the field of movement disorders, and you're expecting them to be able to help you. You've had a test on like a brain scan or a DAT scan, or you've had a CT scan, or you've had blood test done or a spinal tap done. You've had a nerve conduction study. You've had whatever test they can do on you in these brilliant, very costly procedures, very costly facilities. And you might have had even a group of different top neurologists and so on looking into your file and looking into the reports and say, yep, you've got, in the end, it's going to come down to the same thing. Take this medication. And I'm not knocking. If the medication is helping you to some degree, don't you want to find out? Do you want to find out what is causing your condition? And don't just think that your brain stopped making enough dopamine. And I can go in more about my education and more about my understanding here of what brought me to realize this, but you're seeing a man in this video, and you can watch in other videos that I'm showing on custom thumbnail images in this area right next to me on this video here of other patients and other understanding. I think you deserve to understand the different parts of the brain and how they function, and ask your doctors to investigate those parts of the brain and see what they ask you, see what they say to you. Just ask them. Ask them to investigate these parts that I'm going to tell you about in this video. Okay? In this man's first examination, and we did a very complex functional neurological assessment, and I was able to tie in the different parts of his body, including the kidneys, including his stomach, which are connected to the brain. The brain controls the kidneys and the stomach and the intestines and your lymph. It's all connected, and including his cerebrospinal fluid, including his meninges, which are around the brain and spinal cord. And I evaluated his cerebellum. I evaluated the glial cells, which are cells that repair the central nervous system tissue and reproduce myelin in the white matter of the central nervous system tissues. I evaluated his globus pallidus in this first examination, which is part of movement controls of the human brain. I'll show you an image of the globus pallidus here. I evaluated his substantia nigra, which is a very pinkish area of the brain, which is very dopaminergic. It has a lot of dopamine-producing cells in the substantia nigra. And I'm going to describe to you in this part of this video what I found in these different tissues and provided remedies to remove these different disease-causing agents from his tissues. Again, disease-causing agents include hidden infections and toxins. And then in the second exam, I'll report further studies, further in-depth study more about what I found in his kidneys and what I found in his, the large intestine lymphatic tissues, his bloodstream, what I found in another tissue that's part of movement control in the brain, of the brain to body, is known as the red nucleus. We're going to get a bit detailed about the red nucleus, and also about a tissue known as the reticular formation, and furthermore, which is also involved in movements, and also about the hippocampus of the brain, which is memory center, memory control. In his first examination, I discovered, and he followed these steps to the T in his first protocol that he did at home, which this protocol was about 2.5 months long. He did at home and came back to me a little more than probably close to almost 3 months later it was about that he came back to me for his second exam, second consult, second exam. I found in the Peyer's patches, and the Peyer's patches are lymph vessels in the small intestine. And what happens when the lymph vessels are clogged with infection and chemical? We can actually have slow drip of these chemicals to get into the bloodstream that go to the brain that can cause the brain to malfunction. Again, slow drip of the chemicals from the small intestine to go into the bloodstream that can get to the brain, spinal cord, brainstem, and cause the central nervous system tissues to malfunction. And it can even cause a lack of absorption, a poor absorption or malabsorption of nutrients that we need to get to the brain for brain function and for brain chemical production, like dopamine production. Dopamine production doesn't just happen because it's supposed to happen. We've got to have certain nutrients in place to make it happen. So, and we have to make sure that we don't have chemical exposure in the brain that can rob these tissues' ability to produce dopamine, if you believe that dopamine is the only reason for a movement disorder like Parkinson's. I found propofol general anesthetic, which put him to sleep for a couple of other procedures he had done. He had a knee replacement, he had a shoulder replacement done. I think it was a shoulder replacement, don't quote me on that, but he had shoulder surgery where he's got a metal bar in his arm and his shoulder, and he's got a knee replacement done. And he had hernias in the past. So he's been put to sleep on a few occasions. The propofol anesthetic did not leave his body. The propofol anesthetic was absorbed into his lymph vessels in the small intestine, known as the Peyer's patches. I also found, and so what do you think is going to happen when the anesthetic is still in his gut and still can be leaking into the brain? Does the anesthesia chemical make you function normal, or does it make you sleepy? Does it knock you out? So what can happen to the cells in the brain if they've absorbed some of the that are supposed to produce dopamine, if they've absorbed some of the propofol and they're not able to release the propofol and get it out of your urinary system or through your sweat glands or through your lungs to breathe the chemical out, or to go out through your poop. I'm not telling you that getting propofol is bad if you've got to have surgery. I'm not knocking the drug company. I'm just telling you that you may not have really excreted all of the propofol in your system, and it can still exist and still cause your brain not to function as good as it should. So the propofol was there. The midazolam, a sedative chemical, which has been linked in some reports by anesthesiologists and doctors who are doing surgeries on people, where the midazolam, aka also known as Versed, midazolam has been linked to tremor creation or appearance of tremors during surgery when somebody is asleep on the surgical table, that athetoid movements, writhing body movements started to occur, and tremors of the extremities occurred during the surgery, and they weren't there before the surgery. They were not Parkinson's or tremor patients or movement disorder patients before the surgery. And they found that they had to use another chemical to override the midazolam in the system to stop the tremor during the surgery. So I found with him midazolam, sedative, and propofol in his Peyer's patches of the small intestine, the lymph vessels of the small intestine. I found in his stomach, he had, which he was in Vietnam back in 65 to 67, I found he had some Agent Orange chemical in his stomach. Agent Orange provided a remedy to remove the Agent Orange from his stomach and let the stomach settle down. I found more Agent Orange in the mucosa layer of his stomach, provided remedy for that remedy to remove, to help his body excrete the Agent Orange to come out from his stomach, and we provided other remedies to make sure that it could efficiently leave his body. I also found he had in his kidneys, I found some dental amalgam. He does have a couple of crowns in his teeth that he's going to have to get handled by the right type of dentist, because the crowns are pretty old and they're gold-covered crowns. And I will show you an image here next to me of another patient where I found when we had the dentist take off the gold crown, because this woman came to me for a certain skin disorder. She thought she had all the dental amalgam or mercury fillings removed by a qualified mercury removal biological dentist. And when I met this woman, not this patient I'm talking about now, just talking about another woman, you'll see the pictures here that I'm showing next to me, that she had a gold crown in there in her mouth for about 30 years. And when I told the dentist to remove that gold crown, there was infection underneath the crown, which you'll see in the image right next to me. I'll show you two different pictures. You'll see the infections around the tooth. And also, when they cleaned off the tooth from the film of gold that was there and the infections that were sitting on that surface of the tooth, they found a big mercury dental amalgam chunk inside the tooth. The dentist was flabbergasted. How did I find it? But I did find it, and they got it out of there finally. So we did get out the dental amalgam from his kidney, but he also still had dental amalgam, which I didn't touch in this first round because I won't do it in the brain or other parts of the body when there still is potential of mercury in the teeth, because it's going to continue to leach into the brain and leach into the body. And if your dentist tells you that this can't be, and you have another kind of healthcare practitioner that tells you it's false and mercury is not bad and so on, I'm going to put up other links to videos here. I'll show you. You go and watch it yourself, and you can challenge them, you can argue with them, or you can believe whatever you want. This is what I do. This is how I stand. This is my belief system. This is my understanding. And there's a lot of scientific evidence that is reporting that even though the American Dental Association says it's not true, there's a lot of scientific evidence that's reporting that these mercury fillings, these amalgam fillings, are not healthy in the body and that they poison the brain. And just so you know, that getting them out of the teeth does not get it out of the brain and the body. We have to follow exact specific methods to find out where this mercury metastasized from the teeth into the brain and the body. We've got to provide specific steps to get it out. And no, you don't need a heavy metal analysis with a hair and or urine analysis to know where it is, because in a hair or urine or blood analysis for mercury or lead or arsenic or any of these metals, you won't know where the metals exist and how much amount they exist in these different parts of the brain and the body. So those kinds of analyses cannot tell the practitioner exactly the safest and best step to get the metals out of the brain and the body. I've gone through many different practice types before, and now I believe I'm practicing the safest and most effective method to get the metals out of there. And I'll even show you right now, I'm actually going to pause this video. I'm going to bring in a link of a video that's maybe I think if I remember correctly, it's about 2 minutes in length. That's black and white. You're going to see what happened. There's a condition in Japan known as Minamata disease, and how these fishermen and women in this fisherman village that was across from a fertilizer plant in Japan, where these people all developed these movement disorders and seizure-like disorders and Parkinson's-like disorders, and even insanity with the cats when they tested the mercury sample on the cats. They found that these people were poisoned by mercury, and the reason why, how they got poisoned by mercury and developed these terrible movement disorders and seizure-like disorders was because the fertilizer company was dumping the waste from the fertilizer production, which was mercury. They dropped it into the water. The fish became contaminated with the mercury. The people were eating the fish from the water, and the people all of a sudden developed this condition known as Minamata disease. Watch the video, and I'll be right back.
In 1908, Shin Nippon Chiso built a factory in Minamata, a small fishing village in Kumamoto, Kyushu. The company manufactured nitrogenous fertilizers and soon became the major industry in Minamata. By the mid-1950s, Shin Nippon Chiso had become the industry leader in its field. In 1954, the Sanitation Office of Minamata City began receiving reports of an unknown epilepsy-like affliction, which has since become known as Minamata disease. Since the cause of the disease had not been identified, patients were isolated to prevent spread of the disease. Minamata disease is a neurological condition. Mercury poisons the central nervous system, damages the sense of balance and motor skills, which leads to increasingly intense body convulsions and ultimately death. In 1957, the Minamata Disease Research Group of Kumamoto University announced that Minamata disease is a toxic disorder of the central nervous system caused by certain organic mercury compounds transmitted through the intake of seafood. They isolated organic mercury as the sole cause through a series of experiments on cats. In the same year, extremely toxic levels of organic mercury were detected in the human patients. The report submitted to the Ministry of Health and Welfare stated that the underlying cause was organic mercury in seafood, and the wastewater discharge from the factory was suspected. Afflicted patients continued to be found until 1960. A rash of babies were born with brain damage and extreme physical disabilities. The governor of Kumamoto requested a voluntary ban on catches of seafood from the bay.
Okay, now hopefully you have a better appreciation. And again, watch the other videos, links that I'm putting up here to understand more about how the mercury, the dental fillings, can leach into the brain and the body and cause you disease in the body. I also found that he had in his cerebrospinal fluid is the fluid that's around and throughout your entire brain, brainstem, spinal cord. This fluid is around and throughout the entire brain, brainstem, and spinal cord. Any contamination of any infection and or toxin, or infections plural and toxins plural, a mix of many different infections and toxins can get into this fluid, and then this fluid is saturated throughout your brain, brainstem, and spinal cord. Even the dopamine producing areas in your brain and brainstem, when their chemicals are in that fluid, they're going to do what to your brain and brainstem and spinal cord? Do you think it's going to make them function normal or less than normal? Pretty simple, less than normal. Malfunction, less than normal dopamine production perhaps can take place from that. Agent Orange in his cerebrospinal fluid. Xylocaine, local anesthetic chemical in his cerebrospinal fluid. How do you function? Let me ask you this. A local anesthetic chemical, when they inject it into your mouth to numb a tooth, when they're going to pull a tooth or do a cavity filling, let's say, how do you feel when they give you the cup of water and mouthwash to rinse at the end of the dental procedure? When they give you that to rinse around and spit into the dentist sink, you don't feel it really rinsing around in your mouth when you're swishing it around in your mouth. And probably when you spit it out, if you can remember the time you're in a dental chair and you spit that fluid out into the sink, you're probably drooling a bit on yourself. You felt like you couldn't spit right. Your motor control was decreased by the numbing agent, the local anesthetic chemical, which they put into your mouth to numb the tooth and numb the tongue and numb the jaw on that side where they were doing that dental work. So what happens when some of that chemical, I'm going to ask you this, let me put it this way. When it wears off an hour or two after the dental procedure is done, where did it go? Did it just leave, evaporate into air? Did you piss it out? Excuse me for being so blatant and straightforward here. Did it just piss it out right away when you went to the bathroom the first time? Or did some of it absorb into your nervous system and stay there? I'm going to take that point of view. It stays there. It's just like you taking a white t-shirt, put it into water with a blue dye. Take a white t-shirt, put it in water with a blue dye. 10 seconds later, you take it out, it's blue, that t-shirt. Let it dry for a day. Put it in the washer and dryer without a bleach into the washer. Put it into the washer and dryer, even with the soap, you know, whatever you kind of soap, clothing, detergent you use. When it comes out of that dryer, the t-shirt's still blue. The chemical did not leave the shirt. The chemical they inject here into your mouth can go right to the brain and stay there, or some of it can stay there. Xylocaine, lidocaine-based numbing agent in his cerebrospinal fluid. Sensory and motor, when your mouth is numb from the chemical, what do you think it's doing? Or you had an epidural where they stuck it in your back and it gets to your brain. That can happen too. If you're a female and had a C-section for childbirth, what do you think it does to the brain function? What do you think it does to the brain's ability to feel if it needs more dopamine? What do you think happens there? Not normal. Dengue fever virus, mosquito-borne illness in the cerebrospinal fluid, which means that dengue fever virus can get throughout any tissues in the brain and brainstem, even dopamine production areas and motor controlling areas, brain to body. The dengue fever virus can rob the ability of those functions. The parasite from the malarial disease was in his cerebrospinal fluid. Yes, that can come from mosquitoes anywhere. He was in Vietnam for a couple of years. Years ago, okay, I know it's like 40 years ago or so, 50 years ago, but still, you can get a mosquito bite anywhere on a vacation, anywhere in the world, and you can pick up these organisms, even if you listen to Bill Gates, who's a pretty well-known person, right? Windows, Bill Gates. One of the tweets I read recently on his Twitter account was, "I hate mosquitoes," he said. And he compared, I don't remember if he was comparing mosquito bites and the debilitating illness and in some case death that mosquitoes can cause to humans, that he found, he compared the statistics, I think it was of car crashes in a year or of people die in plane crashes in a year, comparing to mosquitoes, and the mosquitoes cause worse than whether it was a plane or car crash. So these organisms, these viruses and even parasites can come from mosquito bites. So why doesn't everybody have Parkinson's? I don't have that answer for you, okay? He also had the West Nile virus, mosquito-borne illness, in his cerebral spinal fluid. I found in the pia layer of his meninges, directly connected to the brain, brainstem, and spinal cord, or I should say brain and spinal cord, St. Louis encephalitis virus. I found the St. Louis encephalitis virus in his dura layer of his meninges. I found in his glial cells, which are the cells which repair central nervous system tissue and reproduce the myelin, I found the dengue fever virus as well, causing inflammation, robbing their ability to help repair the nervous system. I found in his pia layer of his meninges, again, I found the dengue fever there as well. I found the dengue fever virus in his dura layer of his meninges. No spinal tap, no biopsy, no blood test. I practice a very unique bioresonance system. No computer involved. This is all manual, hands-on. I won't get into great detail or explanation of how I'm doing it, but this is what I found, and you're seeing proof from him describing how much better he's doing with my work. Real proof, real person. I found with his the white matter of his central nervous system, which helps to influence and control motor function of the body. I found the West Nile virus. I found with him as well in that first visit, he had one more point here, in the substantia nigra, which helps to control or production of dopamine. I found the midazolam sedative chemical in his substantia nigra. So what do you think the sedative chemical, what does a sedative chemical do to you when you're going into a surgical procedure? It sedates you. It's twilight. It's sort of like I'm kind of asleep and kind of not asleep. I'm very high. What do you think it does to the substantia nigra tissue's ability to produce dopamine when it's loaded with midazolam sedative chemical? What do you think? His cerebellum, which helps to control motor function of the limbs and balance and a lot of other functions in the brain. He had the parasite from the malarial disease. And I also found in a tissue called the globus pallidus, which I don't think I described in this part of this video yet, the globus pallidus, which helps to control smooth movements. When we move, we have to have a balance 50-50 of intention and inhibition, excitation, inhibition. We've got to be able to not have a jerking movement when we're going to get something. The globus pallidus is one of the main parts of the brain that helps us to have a smooth movement, so there's no interruption in the movement. I found propofol, general anesthetic, in his globus pallidus. He came back feeling better. Better dexterity, better speech, better walking, better memory, better cognitive function. I found in his next exam, which he hasn't taken the protocol at the time of this video, I found on January 10th, I found with him a mercury compound that's found in sea salt, Celtic sea salt, white sea salt, pink Himalayan salt. It's supposed to be the greatest thing out there. I believe the same thing too, but it's high mercury dimethyl methyl mercury contamination. In his kidneys, I found aluminum in the kidneys. Hey, think about this. If you were eating Morton's table salt back in the 1970s and 80s or 60s or so, I don't know when they started, but I know I think it was, if I read online, about 84 or 94, where they stopped using aluminum in their production, you have probably absorbed a lot of aluminum heavy metal, which is not good for the body, in your brain I found mercury dimethylmethylchloride in his kidney. Again, I said that. I found lidocaine, local anesthetic, in his kidneys. Dioxin, cancer-causing chemicals in the kidneys. Propofol, general anesthetic, in the kidneys. That was not found in the first round. I found Demerol, pain reliever, muscle relaxer, in his kidneys. I found Roundup weed killer spray, found from the Monsanto GMO foods, in his kidneys. Can't make the brain and body function normal. I found parasitic infection in the kidneys. I found another 2 kinds of mercury compounds in his kidneys. I have 8 different mercury compounds that we can test the body with in my clinic. I found the mercury compound from the pink and the white sea salt in his large intestine in this next round. And I found a Streptococcus viridans infection in his bloodstream. I found 2 different kinds of parasitic infections in his stomach. I found in a tissue, I'll tell you, I'll get to that one next. I found in the white matter of his nervous system. I said in the last round, I told you that I found the West Nile virus. I found the St. Louis encephalitis virus, which we're reading. I found also the, let me just say, another kind of virus, Epstein-Barr virus in his globus pallidus, which helps to control smooth movements. The Epstein-Barr virus in his hippocampus, memory center in the brain. I also found the Epstein-Barr virus in the reticular formation. The reticular formation helps to integrate sensory and motor controls to help us move normally. I'll show you an image of where it is in the brain, just to get you better oriented. I also found the lidocaine local anesthetic in his small intestine in this round. And finally, I found in a tissue, I think that's the final part, yes. I found in a tissue known as the red nucleus, I found the West Nile virus, mosquito-borne illness. The West Nile virus in the red nucleus. The red nucleus helps us control motor function. You cannot have normal motor control of the limbs, of the fingers, of the feet, of the legs, of the body when the red nucleus is infected and or toxic. The red nucleus is really important in helping us control motor function. Why don't you ask your neurologist, ask your doctor in the university or the hospital or the private practice to investigate your globus pallidus, how it's functioning, to investigate your red nucleus, how it's functioning. Ask them to do that. Ask them to investigate. I'm not looking for a DAT scan, DAT scan to see if you have a high or low temperature change in there to say maybe there's something wrong with dopamine production, we may be linked to dopamine production problems. I want you to ask them, is the function of that globus pallidus normal? Is the function of that thalamus normal? Is the function of the reticular formation normal? Is the function of my pons of my brainstem normal? Is the function of my red nucleus normal? And if it's not normal, tell me what to do about how I can improve the function of these tissues. That is what we're getting to here in this video, folks, is to be able to investigate these tissues and start to help the body detoxify and disinfect the tissues so that you can start to remove these different infections and toxins that are causing your brain to not be able and body to not be able to regulate your blood pressure, your memory, cognition, your body functions, your bowel functions. You've got to be able to investigate the brain and the body and understand about the brain and the brain chemistries, understand about the cardiovascular system and the lymphatic system and the kidneys and the endocrine system and the GI system. We've got to understand all of it together and put it all together so that we can, you don't just look at the nervous system and say, oh, it's a nervous system disorder. You've got to understand how everything is connected, and we've got to understand about the different parts of the central nervous system so that we can start to peek into them and find out what's causing them to be interrupted in their function and start to remove these different causes. Watch the other videos that I put up here. I'll put up another few thumbnails of videos at the end of this video. Okay, so stay tuned to the very end. Watch those other videos. Get a better depth of understanding of what's going on with your brain and how you can become a better informed patient or to help you get well. You can like me on my Facebook page. Like me there. By the way, share this video with other people who you know are suffering from Parkinson's or any other condition. So share this video with someone, like my Facebook page. I put up a lot of posts on there. You can get a better understanding about different issues which I deal with and improvement that other patients are experiencing with my unique work. You can subscribe and turn on notifications on my YouTube channel so that you can see whenever you'll get an email when I put new videos up on my YouTube channel. And scroll through this YouTube channel. There's a lot of different videos about a lot of different conditions that we're having great success with my unique work. And you can even follow me on Instagram. I put up a lot of posts on Instagram that you can just click on and watch a video or read about different topics that are discussed there. I think you'll find all that pretty valuable. I will tell you that with my work, it's very unique that there are no insurance codes. There is no way I can bill your insurance policy, whether it's Medicaid or Medicare or an HMO or PPO plan. There is no insurance that accepts this type of work. They don't realize this work. They realize work that you're getting done when you go to the hospital, an MRI or whatever they're going to do, but they're not realizing this work that I offer you. So this will be an investment in yourself, out-of-pocket expense. You can call and speak to my clinic assistant to find out about the fees here, when you can schedule your first appointment. On average, we're about a 3-month waiting list in my clinic. And the phone number here is 954-370-3100. That's 954-370-3100. If you're calling from out of the country, if you want to call from out of the country but you don't want to make the phone call, you can email my clinic assistant and start off the conversation in that manner. I do handle some of the consultations via Skype video conference. Some are by phone, some are in person. Okay? Skype, phone, or in person. Exams all must be in person in my clinic. People do fly to my clinic from around the world. We've had people come to my South Florida clinic right now from Norway, from Romania, from the Netherlands, from Russia, from Uruguay, from Canada, from Australia, from United Kingdom, from Mexico, from all around. I haven't even mentioned everywhere here. Africa has come to my clinic. So people are coming from all around, and it's not too much of a journey towards you helping yourself get better. I look forward to helping you. See you soon.